Hello, today we will talk about osteoporosis and its symptoms. We will also learn about treatment methods and how we can protect ourselves from this disease. And at the end of the video, I will tell you the foods you should consume for the health of your bones. Watch the video to the end for your health, and be sure to like the video, subscribe to the channel, and click the bell button in return for the valuable information I will give. What is osteoporosis? Bone resorption. Healthy, young bones have a structure of minerals, mostly calcium salts, bound to strong collagen fibers. As we age, this structure weakens and becomes flimsy and loses strength. A condition called osteoporosis is characterized by an extreme decrease in bone density, making the bones more fragile. Osteoporosis literally means spongy, porous bone, because cavities form inside the bones, and their density decreases. This makes them more prone to fractures and cracks. Osteoporosis is usually diagnosed by imaging the bones after a fracture or crack has occurred. Osteoporosis-related fractures usually occur in the wrist, spine, and hip bones. The incidence of osteoporosis increases with age and is more common in women than in men. The bones that make up the skeletal system are known as structures containing high levels of calcium. Bone formation occurs rapidly during infancy and childhood. Towards the end of puberty, in the late 20s, bone formation and destruction reach almost the same level. In order to delay bone breakdown with age, attention should be paid to calcium and vitamin D intake from now on. In this way, bone mass and health can be maintained. It is known that bone destruction accelerates with age, and when combined with an unbalanced diet, osteoporosis may develop. Although it does not cause serious problems in the early stages, bone damage can occur as the age progresses. Therefore, it is important to detect the disease at an early stage through routine screenings and to apply the necessary treatment procedures. What are the causes of osteoporosis? 1. Advancing age. Advancing age is a cause of osteoporosis in both men and women. 2. Menopause. A decrease in the level of the hormone estrogen in postmenopausal women is an important cause of osteoporosis. The hormone estrogen has a protective effect on bones. Early menopause or surgical removal of the ovaries also increase the likelihood of osteoporosis. 3. Vitamin D deficiency. In order for calcium from food to be used by the bones, there must be enough vitamin D in the body. Vitamin D is produced in our skin by sunlight. Insufficient sunlight intake and vitamin D deficiency are the causes of osteoporosis. 4. Heredity. Osteoporosis is more common in people with a family history of osteoporosis. The risk of osteoporosis is also higher in people with a family history of spine or hip fractures. 5. Eating a diet low in calcium. Milk and dairy products such as milk, yogurt, and cheese are rich in calcium. Getting enough calcium is an important determinant of bone quality later in life, especially during childhood and adolescence when bone development continues. Therefore, adequate dietary calcium intake is essential during childhood and at all later ages. 6. Lack of physical activity. Regular exercise improves bone mass and quality. 7. Unhealthy habits. Smoking. Excessive consumption of caffeinated drinks such as cola and alcohol affect bone quality. 8. Chronic diseases. Diabetes, thyroid or parathyroid gland diseases, certain hormonal or rheumatic disorders, immobilizing diseases such as stroke, and gastrointestinal surgery are also risk factors for osteoporosis. What are the symptoms of osteoporosis? Osteoporosis may not cause any symptoms in the early stages. Unless a fracture or crack occurs or bone density tests are performed, the disease is very difficult to detect despite the decrease in bone density. As osteoporosis progresses, patients may experience a range of symptoms. Here are the symptoms of osteoporosis. 1. More than 1 inch short stature. It is normal for people to get shorter as they get older, but a loss of more than 1 inch could mean that osteoporosis is causing bones in the spine to break, triggering short stature. This type of height loss is not considered normal. 2. Sudden bone fracture even from the slightest accident. Bones lose strength due to a deterioration in the density and quality of bone mass. This loss of strength leads to brittleness in the bones, and people start to break their bones even at the slightest accident or injury. 3. Severe back, lower back, and neck pain. Back, lower back, and neck pain are also common symptoms of osteoporosis. The most common cause of this pain is a compression fracture of the spine. Back, lower back, and neck pain, which can be sudden and severe, worsens when standing or walking and eases slightly when lying down. 4. Hunchback and change in posture. Hunchback, also known as kyphosis, is a symptom of osteoporosis. This is because osteoporosis weakens the bones of the spine, leading to a curvature of the spine. When the spine becomes weak, the person's posture changes, and a hunched appearance develops. 5. Shortness of breath. Shortness of breath occurs when the discs in the spine become so compressed that they reduce lung capacity, and shortness of breath is one of the common symptoms of osteoporosis. How to treat osteoporosis. Preventing osteoporosis is easier than treating it, don't worry. I will tell you how to prevent it in a moment. To prevent osteoporosis, lifestyle changes should be made at a young age. If osteoporosis has developed, lifestyle changes should be made for treatment. Taking measures to reduce falls, doing exercises under the supervision of a doctor and physiotherapist, dietary changes, regular use of medications prescribed by a doctor are effective in the prevention and treatment of osteoporosis. The medications to be used are prescribed in line with the examinations performed by the doctor. Calcium and vitamin D supplements are required when necessary. What should be done to prevent osteoporosis? The steps to be taken to prevent osteoporosis are very important. First of all, a calcium-rich and healthy diet should be adopted starting from childhood. This improves the quality of bones and helps to maintain healthy bones in later life. Smoking and excessive alcohol consumption should be avoided, and intake of caffeinated coffee and cola drinks should be reduced. Eat a healthy and balanced diet to maintain an ideal body weight. A personalized regular exercise program is also very important. Posture and strengthening exercises as well as physical activities such as walking are effective in preventing osteoporosis. An appropriate exercise program can prevent osteoporosis-related posture disorders and hunchbacks. In addition, as muscles become stronger, body balance is maintained and the risk of falls is reduced. Exercise also reduces stress and improves mental balance. However, since excessive exercise that is not suitable for the individual can be harmful, the type, duration, and frequency of the exercise program should be determined by the doctor. During youth, our bones remain strong. When we reach our 30s, they slowly start to thin out. In women, this process accelerates after menopause, but there are ways to put the brakes on. One of the best lines of defense in your diet, getting the right foods, can increase your bone density at any age, giving you maximum bony strength. Here are some bone-friendly foods. 1. Milk. Calcium is the cornerstone of strong bones. An adult needs 1,000 mg of calcium per day until the age of 50. Women need 200 mg of calcium a day until the age of 70, and men after 70. Without a doubt, the pop star of calcium is milk. A glass of milk, whether skim, low fat, or full fat, contains 300 milligrams of calcium. 2. Yogurt and cheese. Not a milk drinker? A cup of yogurt contains at least as much calcium as a glass of milk. A small block of cheese contains almost as much calcium. Even if you are lactose intolerant, you can eat yogurt and hard cheese without serious problems. Or try lactose-free dairy products. Removing the lactose from milk and dairy products does not affect their calcium content. 3. Sardines. Milk and dairy products are not the only way to get calcium. Another great source is sardines. The bones of these small fish contain the calcium your body needs to build bones. Eating canned sardines provides a little more calcium than a glass of milk. 4. Salmon. Salmon and other types of oily fish improve bones. These fish contain vitamin D and omega-3 fatty acids, which help bones. In women, fish oil supplements have been shown to reduce bone loss and may help prevent osteoporosis. 5. Green vegetables. Many vegetables contain plenty of calcium. Choose green leafy vegetables such as chard, bok choy, and kale. Stemless cabbage and the leafy part of turnips also provide plenty of calcium. 1 cup of chopped turnip leaves contains about 200 milligrams of calcium. If you found this information helpful, subscribe to the channel to get more healthy and helpful content. Click the subscribe button and turn on notifications to be notified instantly about our videos. Thanks for watching. Don't forget to like the video.